Hello everybody, this is Dr. Bob DeMaria with another episode of Ask Dr. Bob. Phenomenal questions. I have this new sympathetic nervous system model that shows you how the brain sends messages to all the organs and tissues. The very first question was a female asking about some of her hormonal issues and wanted to know what to do. Very wise to go to your gynecologist to make sure that you have a physical exam, that everything in your pelvis is functioning optimally. In our practice, we do a lot of extensive work with serum, saliva, and urine that we can help create a strategy for wellness, because all these endocrine systems, all these glands are interdependent on each other, and we could literally drill down and open up to see what you may or may not need. Dr. Bob, I have an enlarged parotid gland, and I have 2 kidney bean size stones in there. So in my book, Dr. Bob's Guide to Prevent Surgery, I have a chapter on cataracts, which talks about calcium and phosphorus ratios. And it is very possible. So you could have a parotid stone, a kidney stone, arthritis, and cataracts and tartar on your teeth. It's all the same physiology. But when you have those type of stones inside of your parotid gland, we do have a product that we use very successfully to help improve parotid stones. You could also possibly have an infection going on inside of your body, because you went into detail about having your teeth cleaned and then the dentist. So it's very possible that your parotid gland is doing whatever it can to help fight off the infection. Dr. Bob, you have a 3-year-old. I have a 3-year-old grandchild that looks like they have some bowel movement issues, and their buttocks tends to be red and inflamed. And you wanted to know about a probiotic, which I think is a tremendous idea. We also use a product in our practice which helps create optimal flora. The product is grown on Tillandsia, and there's a healthy mold for it. Also, we use a product called NutriClear that helps clear the toxins in the gut out. We know, because of my doctorate of natural health studies, that somebody could have a pasty tongue. We call that AMA. And that's just a body signal of a lot of toxicity. So maybe give that child some very thinly sliced cabbage that helps promote healing in the intestinal tract. Dr. Bob, for people who are always cold, even with the extra sweater, chronic coldness, I always think subpar thyroid function. And you don't want just a TSH done. You want a TSH, a T3, and a T4. Refer you to Dr. Bob's Drugless Guide to Balancing Female Hormones and Dr. Bob's Guide to Prevent Surgery. We talk about that in great detail. Dr. Bob, when I sit down to eat, especially at home, my nose starts to run, and it's a real hassle. So one of the thoughts when I was contemplating this is you probably have a food sensitivity to something. I'm not sure what that something is. But we have used molybdenum quite successfully when people have sensitivities to perfumes and vapors and other chemicals. So contact our office. We use a product called Mozyme Forte. I'd like to know what the root cause of toenail fungus. It's a gut problem. It's overproduction of yeast in the gut, and it overflows into your toes. I wrote about this in Dr. Bob's Guide to Prevent Surgery. Tremendous book. Checking to see what you recommend, or would you recommend colloidal silver for a mouth rinse. You know, if you've been using it without any challenge, go for it. We use Agricept L. I personally use Agricept L, which is a citric seed extract, every day. 4 or 5 drops in 4 to 5 ounces of water. Dr. Bob, I'm having trouble keeping my blood sugar below 150. I would stop eating fruit. A lot of people don't realize that fruit could be an issue. I'd want to see what you are eating, but fruit could be a problem. How is your gallbladder doing? So your gallbladder creates bile, and bile takes the layer of fat off of glucose molecules to make them available. You may also have a fatty liver. You were talking about 2 of the drugs that you use. We actually have a specific nutrient that we use in our practice that is it's wonderful for lowering blood sugar problems. Consider coconut oil, because coconut oil also could help lower blood sugar. Wonderful questions. How do you enjoy this model? This is a measure of looking at the sympathetic nervous system. In Dr. Bob's Guide to Sex and Romance, we go into great detail about how the nervous system functioned. Stay tuned. We're going to be re-releasing that book as a healthy marriage book in the fall. I'm Dr. Bob DeMaria.